So let me introduce you first, just in 30 seconds.
Okay, great.
Dana Ullman 是第一批早期非常早期来台湾拜访的顺势的一个推广者，他有大概10几本的著作，那台湾有2本已经翻译成中文版。那他被誉为是美国最重要的顺势医学的推手，所以他自己本身不是西医师，他本身是学公卫的 ，UCLA 的公卫硕士。那可是他在这个顺势疗法的推广上有卓大的贡献啊，甚至他跟过世的这个英女王御医 Peter Fisher 也是很好的朋友。他说他去英国玩的时候都住他家所以他现在等于是有点跟 Peter Fisher 一起做一样的事情，就是把这些科学的期刊一起让大家更了解顺势疗法其实是蛮科学的。那我们欢迎这个 Dana Ullman。Your time.
Ta-da. Well, hello from across the world, in the world of California, United States. And evidence that this is California is just this morning at 3:40 in the morning, we had a small earthquake here. So that got me out of bed early. Okay. So this presentation, I have to hit the share. Let me see. I go to share the screen. Share screen. Here we go. So the name of this presentation is a review of recent compelling studies on homeopathic medicine that have been published in peer-reviewed medical journals. And I like this wonderful prediction that a homeopath gave, where he said, we predict that within another decade, homeopathy will be demonstrated by means so scientific as to place its validity beyond dispute. However, this homeopath said this in the year 1897. So although it does sometimes seem as that acceptance of homeopathy is right around the corner, Big Pharma has other plans, I'm sorry to say, and they've got more money. But we have got medicines that do work. So the first study, an article that I want to make reference to, is for a very serious disease. It's the use of homeopathic medicines in a very difficult and dangerous type of cancer called small cell lung cancer. And this study was published in a major oncology journal called The Oncologist, where the editor is a professor from Harvard. And this research was conducted in Austria, in Europe, at the Medical University of Vienna, with 150 patients. And this study was randomized, double-blind, and had multiple centers. And there were 3 different groups, each with 50 people. And one group got conventional medical treatment and a placebo. The other group got conventional medical treatment and homeopathic treatment. And these 2 groups, the first group 1 and 2, both underwent a homeopathic consultation. And neither the homeopath or the patient knew if they were being given the real homeopathic medicine or the placebo. And the third group was given conventional medical treatment with no placebo and no homeopathic interview. So if homeopathic medicines really are a placebo, there really shouldn't be any difference between these 3 different groups. And let's see what actually happened. First of all, the patients were enrolled over a 5-year period of time, and they were observed for the results from their treatment for 2 years, 24 months. And the groups were matched to be statistically significant so that they were similar groups. Though, as it turns out, there were 10 homeopathic patients and only 4 conventional medical treatment patients, which were diagnosed with a more dangerous type of small cell lung cancer called squamous cell carcinoma. So one would think, because the homeopathic patients started off with a much sicker situation, you would assume that the homeopathic patients would be a lot worse off. Let's see if that happens. So, as it turns out, the quality of life showed significant improvement in the homeopathic group when compared to the placebo by a highly, substantially significant difference. And the mean survival time was almost, in the homeopathic group, almost, well, a good 60% longer than those given the placebo. And almost a full 100% longer than those given conventional medical treatment and no homeopathic interview. The survival rate in the homeopathic group differed significantly from placebo and from the control groups. Very important study. Now, what's interesting is just continue reviewing studies in the use of homeopathy in cancer treatment, which is what is meant by oncology. This was an interesting study that wasn't looking at results of treatment, but just describing how many people were going to homeopaths, in this case, in France. And in this case, in a city in France called Strasbourg. And this study evaluated 633 patients who were undergoing treatment at one of 3 anti-cancer centers. And then of the 535 patients that were ultimately and finally included in this survey, 164 of them, which is around almost 31%, used homeopathic treatment. And just 15 years earlier, when this study was done, about only 17% of these patients used homeopathy. So 17% is actually quite reasonable too, but that even doubled as compared to what happened today, actually in the year 2020. And of the people that used homeopathy, almost 83% said that they were somewhat or very satisfied with treatment, as compared to only 15.5% who were not satisfied at all. And the most common symptoms that people with cancer found benefit from is in some very common and problematic symptoms, including fatigue, pain, nausea, anxiety, sadness, and diarrhea. They were improved in as much as 80% of the patients with cancer. What wasn't as significant in terms of the benefits from homeopathic treatment include alopecia, which is hair loss, weight disorders, and then the loss of libido, which is the loss of the sex drive. Those were the least important symptoms. But to be honest, these symptoms are usually the result of the side effects of conventional medical treatment. And whereas homeopathy can sometimes significantly reduce some of the side effects, it cannot always reduce all the side effects in a short period of time. So the researchers determined that homeopathy is the most used complementary medicine in integrative oncology in the city of Strasbourg. And over the past 12 years, there's been an increase of 83%. It's almost twice as much in the use of homeopathy in the treatment of people with cancer. Well, to continue further with the experience of homeopathic medicines in the treatment of cancer, and I should say that if homeopathy can be so significantly helpful to people with as serious of a disease as cancer, imagine what it can do with less serious diseases. So this was a study published in a conventional cancer journal called Support Care Cancer. And this was published in the year 2021. And once again, they found that homeopathy is the most frequently used complementary therapy in supportive care in cancer treatment in France today. But what's quite remarkable is how many oncologists in France integrate homeopathy into their practice. 10% prescribe homeopathic medicines themselves. 36% recommend homeopathic medicines. 54% think that homeopathic medicines are potentially useful in support care oncology. And 2/3 of the non-homeopathic general practitioners, in other words, the medical doctors who are not homeopaths, 2/3 of them sometimes prescribe homeopathy in the context of providing support care oncology. So, that might mean the use of arnica for certain things, or nux vomica for certain things, or arsenicum for diarrhea, and on. Very impressive. So this evidence of the use of homeopathic medicines in treating people with cancer is now significant enough that in Germany, a leading conventional scientific organization that, although these are the words in English rather than German, but it's an association of scientific medical societies. And they advise on matters and tasks of fundamental and interdisciplinary interests. And they develop recommendations and resolutions, and they represent them at institutions of various sorts. And this highly respected medical body expressed support for homeopathy in cancer treatment. Here's their quote. There are data from randomized controlled trials, that's what RCT stands for, on the use of classic homeopathy, and that due to the strongly positive results of studies on homeopathy and the use of classical homeopathy to improve the quality of life in oncological patients in addition to tumor therapy can and should be considered. This is very significant that a conventional scientific body would show this degree of support for homeopathy. But let's move on to other conditions. As it turns out, one of the leading surgery journals in the world published an article by two surgeons from one of the most respected medical clinics in all of America called the Cleveland Clinic. And they published this study in a journal called Annals of Plastic Surgery. This was in the year 2019. And they reviewed 29 studies, that 20 of which tested homeopathic arnica, and 9 which tested bromelain. Bromelain is an enzyme that is helpful in, well, we'll see how it's helpful. But they found that arnica has a what's called a mitigating effect, which is a reducing effect on redness and swelling after rhinoplasty, which is the surgery of fixing a person's nose, and on facelifts. And bromelain was supported by numerous studies in reducing the pain and swelling from molar extractions. So what they also found was that the frequency of adverse effects of homeopathy, the side effects, was much less from homeopathy. Actually, this is related to a different study. My slides are a little bit mixed up, so I'll discuss this one a little bit later. Okay, so this is a study that is called a meta-analysis. And a meta-analysis is when researchers review many studies on a specific treatment for a specific disease. And this was on the use of homeopathic medicines for children with attention deficit and hyperactivity disorder. It's sometimes called ADHD or just attention deficit disorder. And they analyzed 6 studies for their meta-analysis. And they found that the homeopathic medicines showed a significant effect as compared to the control groups who were given a placebo. And once again, homeopathic medicines have been shown to be helpful in this condition that is increasingly common, where children are both hyperactive and have difficulty relaxing, and they move around a lot, and they can often be very disruptive in schools. But here's where homeopathic remedies seemingly can be helpful in reducing their hyperactivity and then enabling them to learn more. And here's an interesting study, in this case, in a dental extraction pain study in children. And this was what is called a triple-blind randomized controlled trial that sought to compare the efficacy of a homeopathic drug called arnica with ibuprofen, which is one of the non-steroidal anti-inflammatory drugs. And they gave these drugs to children that were having some type of extraction. And they tested 44 children between 8 and 12 years of age who required at least 2 clinical sessions for a tooth extraction in different quadrants of their oral cavity. And my point in making reference to this study is to give you an idea that homeopathy can be used in such a diverse amount of healthcare issues. On one hand, we've shown how homeopathy can be useful to people with certain types of cancer. Another time, this use of homeopathy in conjunction with surgery. And I love this idea because this is such a 21st century idea that homeopathy and conventional medicine can be used collaboratively in what we in America call integrative medical care or integrative health care, where we're taking the best of conventional medicine and the best of natural medicine. And here's another example where homeopathy can be used in dental situations. And so, this showed that ultimately arnica was found to be as helpful as ibuprofen. And ultimately, because arnica is so much safer, a lot of parents prefer safer medicines for their children. Now, the drug ibuprofen is known around the world in a variety of names. Sometimes it's known as Motrin, sometimes it's known as Advil, sometimes it's known as Combiflame. I don't know what it's called for in your country. Now, here's an interesting study that compared homeopathy, and Cam makes reference to complementary and alternative medicine. And so they're comparing homeopathy, complementary and alternative medicine, and conventional medicine in the treatment of musculoskeletal disorders. And this study was not what we call a double-blind and placebo-controlled study. This is what's called a real-world study, where a doctor is prescribing a treatment and they're making very clear what they are prescribing, and no patient is given a placebo. But they try and evaluate the results in terms of how does a person feel and what conventional drugs is this person feeling compelled to take or not. And as we'll soon see, we'll find that patients who are given homeopathic medicines are doing well enough to have substantially less need for conventional medical treatments. So what's interesting about this study is it was a collaborative method, collaborative trial from major professors at major universities, including McGill University from Canada, University of Paris in France, the Pasteur Institute in France, the use of the University of Bordeaux in France, and the famous, indeed famous, London School of Hygiene and Tropical Medicine in England. And they evaluated such common musculoskeletal ailments as osteoarthritis and rheumatism, fibromyalgia, and muscle spasms and tendinitis, rotary cuff syndrome, ankylosing spondylitis, vertebral disc disorders, neck pain, torticollis, and even spinal stenosis. And this also review of musculoskeletal disorders was published in a major pharmacology journal that looked at not just pharmacology and its effects, but also at drug safety. So this study was a large study with over 1,100 patients. And they found that homeopathic patients with chronic musculoskeletal disorders use almost 50% less painkillers. And the NSAID are the non-steroidal anti-inflammatory drugs. And then patients with acute musculoskeletal disorders used 38% less of these non-steroidal anti-inflammatory drugs than those under conventional medical care. And despite this sharp reduction in conventional painkillers, the homeopathic patients showed a similar clinical progression. In other words, they were not getting as sick as others on conventional medical treatments. And then here's a study that evaluated the elderly and their use of pain medications. And this was also what we called a real-world observational study that showed how elderly patients who were 70 and older with musculoskeletal disease were found to take these non-steroidal anti-inflammatory drugs almost 4 times more when they were under the care of a conventional doctor as compared with under the care of a homeopathic physician. Once again, those patients that were seen by conventional medical doctors took 4 times more of these pain-killing drugs than those given homeopathic treatments. That's just remarkable. Okay, here's a study on depression and hot flashes in women who are near menopause or after menopause. And this particular study compared individualized homeopathic treatment with a drug called fluoxetine, which is the depression medicine called Prozac. And this is for women who had moderate to severe depression and who were near or post-menopausal. And this was a randomized, double-blind, and placebo-controlled study. And it was published in a major, very conventional journal called PLOS ONE. It had 133 subjects. And it was even conducted at a academic and research hospital in Mexico City that belongs to the Ministry of Health of that country. And there were 6 weeks of treatment with either individualized homeopathic medicine or this Prozac or a placebo. And in this case, they found that the patients given the homeopathic medicine experienced a lot less symptoms. What they found is that the homeopathic treatment decreased from 21.2 to 9.9 points on this scale, whereas Prozac, did not have that same degree of reduction. And so they found that the effectiveness of homeopathy to reduce depression was at that last number, the p-value was 0.0001. And this is very, very impressive results. So 54.5% of the women undergoing individualized homeopathic treatment had a 50% or greater response to treatment, whereas from Prozac, it was only 41.3%. And with a placebo, it was only 11.6%. And then they used these different scales, and they found that the homeopathic patient, the women given homeopathy, had a reduction in their symptoms, where Prozac or fluoxetine had a slightly increase in symptoms. And so this was also quite impressive. However, as good of a study as this was, what the skeptics are now doing is they're getting the editors of whatever journals have published positive studies to retract them by saying that even though the studies showed that the homeopathic medicines may work, that it's impossible for them to work. They claim that the mechanism of action of homeopathic medicines isn't fully known. And because we don't know how they work, they then assume that they can't work. And what's so wrong here is that we didn't understand how even the simple medicine aspirin worked until sometime in the late 1980s. But no doctor ever didn't use aspirin just because we didn't understand how it worked. And in modern surgery, surgeons and pharmacologists don't always understand how different pain-killing drugs and anesthesias work. We don't actually understand that. But I've never heard a surgeon say that we're not going to give anesthesia just because we don't know exactly how they work. So, sadly, when you hear people say follow the science, sometimes you really have to follow the economics and see how and why conventional big pharma companies are so afraid of the emergence of homeopathy. So there's 2 articles that I got published in the year 2021. One is I reviewed 4 government-funded studies of homeopathic research. And this was published in a conventional medical journal called Curious. And I'm very proud of that review of research. No one had ever reviewed this research that has been published by 4 governments. And what the story is, Australia did a study, England did a study, and Switzerland, as per what the Swiss do, they did 2 different studies. One by skeptics of homeopathy and one by advocates of homeopathy. And you can somewhat predict how and why each of those groups came up with different conclusions. But then I also wrote a very technical article where I explored the mechanisms of how our nanodoses work in homeopathy. And ultimately, I showed in this article, and referencing the most recent research, that it is no longer appropriate to call homeopathy implausible. It actually is quite plausible based on modern understandings of the physics of water and of the power of nanodoses of certain substances. So both of these articles together, one which confirms that the evidence around clinical efficacy and clinical relevance, and a second article explaining how homeopathic medicines in fact can work. And finally, I want to make reference to what's called a systematic review, which is a type of meta-analysis which reviewed a large body of clinical trials, and that they found that in reviewing 32 eligible randomized controlled trials, that there was a body of evidence to show that homeopathic medicines are effective. And what's really interesting is not this, but this quote, where they also made note of the fact that 5 previously published systematic reviews have examined the randomized control trial research on homeopathy. And they found that 4 of the 5 of these studies reached the conclusion that homeopathic medicines differ from that of placebo. And this article was published in a major conventional journal that specializes in these systematic reviews. So whenever anyone says that there's no evidence, scientific evidence that homeopathic medicines work, what they are really saying is that they don't read the research, don't know the research, or are simply not being honest. So for those of you that want to learn more about research that has been published in conventional medical journals, I've written an ebook. It is only in English, I'm sorry to say, but and this is over 600 pages. I provide reference to over 400 studies. I list 100 conditions, and more than half of the conditions include a study published in some type of peer-reviewed medical journal. So that's all I need to say now. And if people have any questions, I'm open to hearing whatever questions you have.